Welcome to Lifestyle Medicine. This is Dr. David Drozik asking, are you ready for health? I'd like to share my story with you. I was a busy general surgeon, hit my early 50s, and decided I probably should go see a primary care provider. I knew I was overweight, and I had heartburn, for which I was taking the purple pill, but I found out I also had prediabetes, high cholesterol, and high blood pressure. My primary care doc did what most primary care docs do. He pulled out his prescription pad and he wrote me some prescriptions. He wrote me a prescription for Janumet, which is a combination medication to control diabetes and to prevent it from progressing, and it promptly caused diarrhea. He also wrote me a statin called Crestor, which gave me muscle cramps. And he said, I'll wait and give you something for blood pressure later. Who knows what side effects that would cause. And I continued taking the medication for the heartburn, which now we know has been linked with osteoporosis and kidney disease and dementia. He didn't say anything about diet or physical activity, but I knew a little bit. I knew I probably should quit drinking my Dr. Pepper, and my Snickers bar that I was eating every day needed to go. I heard about this Mediterranean diet and I thought, well, we were eating lots of fruits and vegetables anyway. I could do that. So I continued to have my skim milk on my morning cereal and low-fat yogurt most days, as well as lean meat. And I thought, this is good. I did lose 5 pounds and I went back to see the doctor. He redid my blood work and my cholesterol did improve, but at the cost of the muscle cramping that was slowing me down from the physical activity I needed. The blood pressure hadn't changed, but he hadn't given me any medications yet. But the prediabetes was rapidly progressing toward diabetes. So I resigned to declining health and thought I'll do the best I can to hold off those complications of diabetes, which I did not want to have. In May 2011, my life was changed. I went to a health summit provided by our local Live Healthy Appalachia here in Athens, Ohio. I heard Drs. Caldwell Esselstyn and T. Colin Campbell present the research that was featured in the documentary Forks Over Knives. Dr. Esselstyn, who formerly had been chief of surgery at Cleveland Clinic, talked about his research with end-stage heart disease patients. People who had received all the procedures Cleveland Clinic could offer, stents and bypasses, and were put on medication and told there wasn't much else that could be done, go home, that they had a life expectancy of 1 to 2 years. He brought them into a study, put them on a plant-based whole food diet, and they got well. Their clogged arteries actually opened up. And he said, by the way, in the process, their cholesterol normalized, their diabetes got better, they lost weight, their blood pressure improved, and they got off of their medications. The documentary Forks Over Knives features many of his patients who 20 years later are living full, active lives long after they were expected to be dead. I'd already been through the stages of behavior change. I was ready to make a change. I just needed to know what to do. So I spent a little time verifying what I heard through other science, came to the conclusion that this was real, made the change to a plant-based whole food diet, lost 30 pounds, heartburn went away, I no longer need medication, the blood pressure, cholesterol, prediabetes, all normalized without medication. And those are some of the same results we'd like to see you achieve as you work with us in lifestyle medicine. Are you ready for health?